Welcome to Healthcare Quality and Risk Matters, the show where we dive into the topics that matter most in healthcare quality and risk management. Wondering about patient safety, quality improvement, or risk mitigation, but weren't sure who to ask or were afraid to ask? Well, you're in the right place. We create a safe and judgment-free space to explore these critical topics together that will leave you informed and inspired to make a positive impact on healthcare and patient outcomes. So let's learn and grow together because healthcare matters.
Well, good afternoon, everyone, and happy Wednesday to you. My name is Gary Bierce, and I'm joined by my esteemed colleague, Rob Sandamore, and this is Healthcare Quality and Risk Matters, the August edition. Hey, this month, we're talking about Leapfrog. We do this every year. It's more of a prompt for us to talk about the importance of these ratings that come from independent sources like Leapfrog or CMS or what have you. And how you as a hospital or a healthcare organization need to pay attention to them, but also leverage them if you can to let people know that you are operating with their best interest at heart. So, Rob, let me begin. Tell me a little bit about Leapfrog and what it's doing and how it's creating its ratings. So what are some of the things that they're looking at that maybe is different than CMS? I do want to put one disclaimer out there to everybody. We are not representing Leapfrog at all. It's just one of the ones that are out there that is gaining popularity, and it's just a great excuse to, to talk about rating systems. But let's talk about what Leapfrog does. What are they looking at?
Yeah, so in a very high level, Leapfrog looks at there's general operations, yes, but more so there's patient safety indicators.
Okay.
Things like hand washing. Did we do appropriate hand washing? And do we have quality systems in place to monitor that we are actually doing that? So it's not just that it's happening. How did we operationalize quality to make sure it happened? I.e.,
are they making documentation too? Okay.
Yeah, so it's not just that you did the hand washing. It is, do you have the documentation to support that you operationalized quality controls? And assessments. There's to ensure that it did happen, i.e., you have a hand washing audit and you hit your 98%. There's assessment across all units. It has things for Coddy's collapses, right? So catheter utilization, central line utilization, what are the quality controls around those things? And then general quality oversight and management, there's guidelines. And with all that coming to the point that Leapfrog wants to make sure that you're doing the right things for the right reasons and that your organization is patient focused and that you can ensure that it's actually happening, which is a little more granular than CMS. CMS is rating you on, of course, many different types of metrics depending on your organization type. But they have higher, there's assessments that they're doing at like maybe a 50,000.
So you're saying that Leapfrog can be a little bit more granular.
Yep.
In terms of the specifics looking at versus CMS.
Yes, and Leapfrog
is it fair to say that if you do poorly in Leapfrog, it's possible you're not going to do that. You may not be as bad of a rating in CMS.
So I would expect that all of your ratings are pretty similar. Where you see discrepancies is the lag in data. So CMS can be up to 3 years back. There's on some of the data points.
Leapfrog is recent. Yeah. Like we have a recent survey that's come back.
So
we're up to date. Okay.
When I'm thinking about like healthcare for my family, I look at the facility that they're going to, and I look at CMS for how they've been doing, and I might look at Leapfrog for how they are doing. Leapfrog is a more current, there's self-reported data that is auditable. So there is quality control from Leapfrog, but it is self-reported and it is much more current. There are some data points with CMS that are current, but many of the data points are, there's up to 3 years old. So quality is a long game, right? It's not something that you can fix today. It has to be invested in. And you have to do it consistently, constantly, over time.
Are there other independent agencies or organizations that do what Leapfrog does?
There are some that do similar types of things, right? Like Health Grades can be one of them. There are patient-reported data point organizations like that. There's to me a lot of your accreditations and accreditation certificates of excellence. So you can have Joint Commission Certificate of Excellence or American College of Cardiology certificate. You have these specialty assessments. There's specialty certificates that help build your reputation and show the world that you are a quality organization and that they're treating the patients well and that the patient outcomes are good, but also that they're a good business, right? Because to steal your words, Gary, quality is good business.
Yeah.
It just is, right? It ensures your revenue line, and I know we're going to get into some of that, so I don't want to jump ahead. But these metrics, these public facing, there's grades, right? Your 5-star, that's a grade. An A is a grade. There's is something that people use to make a decision about your care and likely reflects the data that is impacting your reimbursement rates. There's your risk exposures. There's the general trust and reputation that your providers, nurses, there's ancillary services and general community have. There's for your hospital and your ability to recruit. Recruiting staff in 2025 is if I said it was a challenge, I would be downplaying it significantly. So you need to be a top mark organization, or people are not going to risk their license working for you.
Speaking of staffing issues, we know that's one of the bigger factors that are driving struggles out there from a quality perspective. What would you say is the number one cause of the staffing challenges that exist out there?
I have heard quite a few different causes. I know data supports nurse staffing ratios. I know data supports physician liability concerns. And that's a big one that we see in consulting, right, is physician liability and lawsuits. And unfortunately, those are going up because of potentially lack of quality, risk, and compliance protections that the hospital is offering.
Down spiral when it starts.
It is, unfortunately. There's in general, there's feeding back to your revenue line. If your hospital is billing well, they are retaining incentive programs, and they are financially healthy, they can pay their staff more. In 2025, salaries are higher than they have been historically for there's people in healthcare. And everybody is looking. So if I'm not making what I want to make at hospital X, and I know that they're a B score and that they're a 3-star rating in CMS, and I know that they don't make as much money as hospital Y, I'm going to jump to hospital Y, and I'm going to bring my license in my patient capacity. So my potential revenue to the hospital, there's to the next hospital that's going to pay me more.
Now, is there a marked reduction in the number of people going through nursing and medical school?
There is a national shortage that is only getting worse.
So is it fair to say that retirements are greater than new people entering into the industry?
There's yes, and there's Mr. Pierce here. Has an amazing point. Because of our low staffing, because of our challenges in recruitment, because we have to up ratio many of our nurses and doctors, and the general environment can be really challenging at times, especially when you have an organization that needs improvement in their quality and risk processes and they don't have a lot of support for their staff. Burnout is a massive issue. And all of this affects the bottom. There's Mr. Pierce, and all of this affects your bottom line. Amazing.
Man after own heart guy.
And right, and same page, and I fully agree. And when you are investing in quality, to steal your words again, Gary, you're buying back your potential revenue.
Yeah. It's an investment source, right? It's a source of capital.
Agreed. Yeah. And I do mean there's your potential revenue in multiple different ways, because you know what your potential expected billables may be, right? But then you have all of this money sitting at the table. There's hospitals aren't even aware of and don't realize the level of control they have over. There's pay for performance programs. They can be throwing away millions of dollars. There's by pulling focus, there's off of key measures, right? And when I say key measures, I mean there's something like falls, right? You want to reduce falls for liability, patient outcomes, there's and general regulation. But if you reduce falls, that could be a pay for performance program that you have with private payers that's giving you $300,000, $500,000, $1.1 million just to reduce falls, because it's costing that insurance company money.
Well, let's loop this back to Leapfrog. So Leapfrog is using a kind of like a high school college grade system, right?
Yeah.
Okay, so if you're an A rating, you're a top-notch hospital. If you're getting a D or an F, obviously you've got major concerns. But if you're hovering in that C area, you're iffy, right?
Mm-hmm.
So, and I've noticed that hospitals seem to bounce around. They could be A one year, and the next year they're down to a C, and things can bounce around. CMS is different, right? It's a 5-star rating. Is that correct?
It is a 5-star rating. Yep.
So what is a 5-star?
There's 5-star is really, you can prove over time that you're doing all the right things for the right reasons. You're hitting your quality metrics. They're giving the patient a really good experience. That's a big part of it, right? Your HCAP scores. How are the patients rating you? Do they feel like the doctors and nurses explained to them there's what's going on with them, how to care for themselves? That's a huge part of readmission rates, right? And then that also feeds into, are your readmission rates good? Amongst many other things, when you're doing well in all of those areas, you're likely to score a 5. There's in your CMS rate, star rating.
So CMS best is 5, 3 is mediocre, 1 you're a loser.
Yep. And for any of those ones out there, we know you can get there.
Right. But Guy made a great comment that, look, if you're at a C, a lot of people aren't going to want to do business with you. He just made the comment. He goes, they deal with only A and Bs only. Right.
I love this question from Mr. Pierce. What are the KPIs you feel are most important? So I feel there's all of your patient safety indicators. There's your HCAP scores. Are arguably the most important. So your patient safety indicators indicate there's a cross-functional, there's performance level. There's either really high or really low. And when I think about things like surgical site infection, that is not just the OR. That is pre-op. That is post-op. That is your med-surg units, right? That it's multiple units that have to have high performance. There's for just that one measure. So it shows a systemic, system of quality. And then those patient safety indicators directly feed into your star ratings, as well as potential revenue, right? PSIs and HACs, so patient safety indicators, hospital-acquired conditions, have a direct impact on penalties to the organization. And pay for performance programs almost always have some type of PSI or HAC on them. So helps your bottom line, helps your star rating, and shows a system of quality. Your HCAP scores show the patient experience as to whether or not they're experiencing quality as well. Yeah. So that is my opinion.
All right, so let's step away from the equation a little bit here, okay? We got C ratings are out there. You C or below, you need to be taking some drastic action. I want to hold that off to the side, okay, because we want to address that head on. If you're a B or an A, okay, if you're an A, you got to stay on top of your game, right? If you're a B, you need to be striving to get into A. Find out where your gaps are, close those gaps. Next cycle, stay on top of it. Maintain your culture of quality that you have obviously put in place to even receive an A rating or a B rating for that matter. All right. Now, moving over to C and worse, something's going wrong. So I was thinking, Rob, that we have put out some things before. One of them, we put out the 4 kind of pillars, principled pillars that an organization needs to think about and do a quick check, right, to see, are they failing in one of those areas? Do you remember the graphic that I'm speaking of?
I do. Actually, as soon as you started saying that, I started to search through our presentable slides in our deck. And I do have the trio, the quality.
The three pillars. Yeah, the three pillars.
We do have another. There's 4 where we talk about.
I like this one even better because this is a great way for somebody quickly to do a gut check, right?
Agreed.
Am I failing culturally? Am I failing with how I'm confronting risk in my organization?
I like
or is it happening operationally? Yeah. Right. And then from there, you then need to get yourself back on the pathway towards quality. So I was wondering, maybe we can put that up. I know that's one of our better ones.
Yeah. I did try to share it. I hope it's sharing. For those on the call, for those that are audio only, it highlights just what Gary was saying. It's talking about risk, operations, and culture, right? So there's both identification, assessment, and mitigation plans, how they're operationalized, and then how they're executed, right? Your culture decides whether or not they're executed. Your culture is going to decide whether or not you're going to operationalize the plan, the budget, the strategy. There's the processes. Do your employees and leadership care enough? They're starting with the C-suite. It's important. There's to keep in mind that, yes, it's very much about the patients, and that is what comes first. But what ensures the bottom line of the hospital, is high quality for that reimbursement impact, trust and reputation, staff recruitment and retention. Mm-hmm. There's none of those things are going to happen unless you have quality at the core of your organization.
Yeah.
And we have the pathway to quality.
This slide, I think for those who are watching, this is very, very important because every organization who's trying to go from obscurity to becoming a highly reliable organization has to follow a certain path. And there's no way of avoiding it. What often happens is people slip, they backslide, they get stuck, or we've talked about it before, they get off-roading, right? You want to be on the road, not off-roading, right? Stay on the path. Stay on the path, and you'll get there. If you try to cut corners, you're going to run into the weeds or run into a forest, and you're going to get stuck. Or the swamp. You can see the one swamp in these turns. When you go off-roading to try to take shortcuts, you can get yourself into some real trouble. So, Rob, why don't we just walk through each one of these steps very quickly to just give everybody a refresher. Now, if you're on audio, we'll just talk about it. There are 8 steps. The eighth level, meaning that you've reached HRO status, highly resilient organization status. But we're going to talk about 1 through 7, the pathway to get to HRO. So go ahead, Rob.
So for all those listeners, and I see some amazing questions coming in, and I promise we will get to those in a moment. So starting with, there's proactive quality and risk. You have to have the mindset, the culture, There's in the general like foundation. There's Chrissy, thank you. I see you popped that word and I just stole that from you. And yes, the foundation of quality, risk, and compliance in your organization. Do you know where you're starting? Do you know how to prevent there's unfavorable risks from happening? Do you know to ensure quality? And then step 2 is, do you know what the general expectations you have for your organization are? There's the right what, and then what are the outcomes for that? There's your O to E in quality. And then how are you monitoring all of this? How are you managing? There's
put the system of quality in place.
Yeah, and you need a system of quality. You need a 7-step safety, quality, and risk management process. You need something that identifies. You need something that assesses and reviews. You need something that allows you to take action. There's prevent, there's analyze, and then track and trend, right? And how are you ensuring visibility, escalation? There's all of that is extraordinarily important. There's in order to continue forward at all in a intelligent way without launching off of this circle into Nowheresville.
We've talked about it a lot. People get stuck right here in the circle.
They do.
And when they're stuck in a circle, they're not getting out of C status.
Yep. Right? Oh, you're not wrong.
They're going to hit some basic things, but unless it is strategic and culturally aligned with the organization, they're not getting down the road anymore. They're kind of stuck.
They are not, and you can see organizations that are stuck here, and you can see that those are the ones that are on the news because they're worried about reimbursement rates. And if they lose one payer, then they could end up in bankruptcy. Right? These are the organizations at risk that are stuck here. There's high risk exposure, potentially poor reputation. And likely have a hard time recruiting staff. So you're literally staying in this cycle.
Right.
That you don't know how to get out of. There's when you have poor systems in place.
And that's what we're trying to say in this pathway is think strategically about this.
Which is our next
culturally about this, which was, I think, Chrissy's point, right?
Yep.
You do that, then you're breaking out of this cycle, this circle, and you're now getting down the road towards being excellent. Right?
Agreed.
Right.
That is the
second big thing, though. They get stuck because they don't continually improve.
Agreed.
They make a stride forward, and then all of a sudden they've got a flat tire and they're kind of stuck.
Yeah.
They're not.
I love this car road analogy because it is. But it's also healthcare is a constantly moving scenario. It's a constantly moving target. You get new regulations every day. You get there's guidance from accrediting bodies. You have new risk events that have popped up. And if that is going to keep you from spinning out, if that is going to keep you spinning out of control, and it's not something that you say, you know what, we are strong enough as an organization. We know ourselves well enough. We have our processes in line. We are strong. We know our risks. We know how to manage incoming risks. There's in changes and how to control change. Yeah. If you don't know how to do that, you are going to fly off this road. When you have good programs, you can say, oh, that's fine. Let's go ahead and just, bring it in for an implementation plan and launch. Right. It should be that easy. And you can do that when you have cultural alignment, you have good strategy because you've implemented good systems. And then on to phase 4, you're continuously growing and improving. Here's
another real good pitfall, Rob. How about when people they're thinking in a continuous improvement manner, but they try to cut the corner and try to jump to measure, monitor, maintain, and they don't have proper systems.
Oh, that is so true. I see that so often. Be like, yep, we see it happen. Let's literally just jump right to.
And that's when you get lost in the trees, right? You get lost in the trees. You get analysis paralysis. You have a lot of different things that begin to emerge in the organization, and again, it gets you stuck, right? Agreed. You're not improving along the pathway of quality. Same thing with trying to cut the corner from innovation onto long-term quality or HRO. You try to cut that without thinking about measurement and monitoring and maintain. So let's assume you've got the right systems in place, right? But you're trying to bypass trying to deploy the right metrics to manage this process and leap across to long-term quality and HRO. You're stuck. You're stuck in the swamp, right? You're not going to get there.
No.
So you this has to be a continuous process where you're adopting all the right things that get you to the top of the ladder. And if you're out there and your organization is a C-level Leapfrog score, take this whole thing to heart. First of all, do the gut check. Look at the 3 core elements that surround the core of quality and see where you're struggling. Second, get back on the road, right? Get back on the pathway towards being an HRO. You do these things, you'll be an A in no time.
Absolutely. I fully agree. Chrissy, thank you so much for your comment. And I fully agree. The quality foundation has to be embraced from the highest levels of the organization.
And that's a challenge in many organizations. Yeah. Quality is often looked at as a compliance exercise. It's often looked at as a thing we have to do, not what we want to do.
Agreed. If your organization it doesn't have strong leaders, to your point, Guy, that do not understand the importance to apply quality to all operations. Modeling that and making room and space for all of your team members to model that and to exhibit those qualities, and then holding everybody accountable to that. You are never going to get to HRO, and I would argue that you're probably never going to even score well in Leapfrog or CMS, even by accident. Quality doesn't happen by accident. It is intentional. We are too data driven, and we're only getting more data driven as we move through. There's time.
But go back to the roadmap. I mean, that's when you've got it. Before you can go into all this data and measurements and metrics, you better have good systems in place that are able to translate what that data means back to the individual things that are happening in your organization. And it's critical.
Agreed. And Chrissy, we also fully agree with this. There's your revenue. There's your full potential revenue. There's when you're paying penalties, when you're paying citations, when you're paying erroneous legal fees. You are throwing away pay for performance dollars that are millions of dollars on top of your expected billables. Your revenue line is so precious, more so today. And every day, we need to invest in quality in order to protect our revenue.
So, Chrissy, we've on our podcast many a time have said that quality and compliance could not only be revenue protectors, but could be capital producers. Because organizations, the way that they manage their financials, particularly hospitals, they're accruing large amounts of money to deal with quality errors, fines, lawsuits, and the like. If you turn quality and risk management into a weapon, you can now free up that capital and be using it for growing the hospital's reach. Adding new orthopedic, hip replacement equipment in your operating rooms, right? You now are freeing up the money to do these things, which just perpetuates you forward, which, by the way, Chrissy, that's a revenue increaser, right? Yep. So that's that kind of mindset, I think, is what's being lost by executive leadership in many hospital organizations. They're putting their eyes on the wrong metrics and not thinking of the long game.
Agreed. And Chris, 10 years ago, I was having this argument that there's, quality and compliance are capital producers. And I would have my leaders in many different organizations argue with me and say, you don't bill anything. So you do not contribute to our revenue. And they would argue over and over and over again. And I still cannot understand how they are so short-sighted, yet so intelligent. And I so appreciate your awareness and intelligence in sharing this and agreeing with us. That quality and compliance are capital producers. They just are.
This is kind of one of those, management.
Yeah, right.
Wow. Oh, yeah. Okay. I don't need to just be fundraising. I can just do a couple things right.
Invest a little bit of money. That's it. Yeah.
Right. Invest a little bit of money, and I can get a lot of money out of my own organization. But Rob, you've talked about in the past hospitals that are failing. They get into this down spiral and they never get out, and they close the doors.
Yeah.
And it's just sad. And whole markets are not being served that should be served, particularly in rural areas in the United States, not getting served because hospitals just could not get their act together. And something fundamental is this. And they look at it short-sighted. What do you mean a guy spent a couple $100,000 on software? I mean, that couple $100,000 is going to free up millions of dollars,
Oh, agreed. And this user right here, and I'm so sorry, we must not be connected, so I'm not able to give you credit for your comment. But payers are willing to add revenue to engage providers to increase quality. That is true, and it's not even just in the hospital system. It is PCP groups. It is independent providers. They are incentivized to do well. I know that often payers are considered the bad guy, right? And everybody's entitled to their opinion. But one thing that we can acknowledge is that sick patients are expensive. And both sides of healthcare agree with that, whether it be payers or hospital systems and the care providers. Sick patients are expensive. Insurance companies are engaging their providers. They are engaging hospitals to try to make patients well, because that does make patients less expensive. And they're also in the finance game, right? They need to make money to keep their doors open.
Yeah.
I don't know that we need to see them as the bad guys. I think we can see them as a partner and use their incentive dollars to make our organization better by doing well with our quality, risk, and compliance programs.
Yeah. Well, we're at the end of our half hour. Can you believe it?
Wow, that went so fast. I feel like I could say
words, but we have such a wonderfully engaging audience today. So maybe we put the last word out to the audience. If you guys would like to give us your final comments, we'll say them on air. And if you have any last questions as well.
Chrissy, even the simple task of improving quality reduces the cost of rework. Absolutely. Whether it be through a lean process, just general reduction of waste. We do a podcast on the cost of poor quality, and there's an auto calculator that will even help you really estimate your organization's cost of poor quality and show how much even improving one process can save your organization. And Guy, goes back to initial conversation, to educate the client up front. Absolutely. General awareness, and starting with the knowledge of where you are. I couldn't agree more.
Wow. Great podcast today, guys. Thank you, audience. You made it even better, giving us some encouragement and some important insights that we could share with everybody. We have a passion for this stuff. Obviously, you can tell by Rob and I when we get going and talking about quality. But what makes this podcast worth something is you guys that have been participating today. Please like our podcast on LinkedIn. We also post this out on YouTube. So please like it out there. Share it with your friends, please. Repost if you can. Do whatever you can to help support this podcast. We're trying to get the best content out there to our community, and we need your help to do it. We are going to leave now, and then we're going to get on to our after show. Warning, when we get into after show, we talk more about the Aperitisoft healthcare product. Is there a way for folks to participate in the after show live?
Yes, directly on LinkedIn, there in the comment section, there is a link that will bring you right to that YouTube live.
Great. So I hope some of the folks that have been on the live will join us over at the after show as well. And any other final comments, Rob, before we depart?
If anybody wants any of the resources that we share during our podcasts, please let us know. Email us at insights@aperisofthc.com.
Yeah, those two graphics, we'll get those into your hands as soon as possible. Yeah.
We will get that, and we are always happy to have any type of collaborative conversation with you, and we love geeking out about this stuff. If you can't tell, we care about it a lot. So please reach out, and we'd be happy to chat.
Yep. If there's anything we can do to help you and your organization, we're here to help, even if it's just some advice. So please feel free to reach out. Next month, we're getting into our September. We originally were planning to do one thing, but we have changed our mind, everybody. And we're going to talk about AI in healthcare next month. If you guys are watching the news, something happened that dropped me off. If you're watching the news recently, guys, a young teenager recently committed suicide at the urging of an AI bot, which just brings shockwaves to your spine that something like that can happen. But it is giving us a warning that although AI is a powerful tool and can help us in healthcare a lot, we got to watch where we're using it, and we got to make sure they're proper safeguards. So we are excited to be talking about that next month, and we hope that you'll join us and bring that great content like you did today to make it a richer experience. So I guess we'll be signing off, everybody. We'll see you next month. And for those at the after show, we'll see you there in a couple minutes.
See you soon.